The healthcare system in America is very confusing. Most people, when asked, do not know much about it. Today, my goal is to explain to you why the Affordable Care Act was introduced, the benefits and limitations of the law, and how we might fix some of the problems that Americans have with it. The term Obamacare carries a lot of confusion and recently a lot of negative connotation for the American public. Even more so with the election of President Trump, as the new administration has said they will be repealing the law, but it is unsure what they will replace it with, which is kind of scary for Americans. Before the ACA, the U.S. was in trouble. At that time, 82% of Americans believed we needed reform. 50 million Americans were uninsured. That's 1 out of every 6 people. This number was projected to grow if Congress did not vote to reform the healthcare legislation. Why were so many people uninsured? Well, people simply could not afford many insurance plans, even the basic ones. Even employer-sponsored family coverage more than doubled over the previous 10 years to $13,000. This is just too much for the American public to spend. Our inefficient system was hurting our global competitiveness. According to the OECD, we were spending about $9,000 per person per year, which is twice as much as our competitors, Canada and the UK. We also devote 18% of our GDP on healthcare expenses. That's a huge chunk of what America makes, compared to around 10% in the UK and Canada. This causes a drain in domestic spending and ends up hurting things like education and transportation, which are also valued by the American public. Simultaneously, our system was hurting health outcomes. So not only were we spending more money than other countries, we were sicker than other countries as well. We had fewer doctors, lower lifespans, and higher infant mortality rates than other OECD countries. In order to fix the obvious inefficiency of our healthcare system, Obama fought to reform the system and signed the Patient Protection and Affordable Care Act into law in 2010. The goal of the Affordable Care Act was to give more Americans access to affordable and quality health insurance while reducing the growth in U.S. healthcare spending, so kind of trying to kill 2 birds with 1 stone. These new health insurance marketplaces allowed shoppers to compare plans with the goal of creating competition between companies, hopefully driving down the cost for consumers. The plan also included tax reforms that would redistribute wealth and subsidies to lower premiums and out-of-pocket costs, as well as an expansion of Medicaid. All of these were efforts to try to expand healthcare to more of the American public so they could have access to it, so that hopefully we could be spending less money and having better health outcomes. The Affordable Care Act was successful in increasing access to health insurance for some Americans. At least 7 million gained coverage that were not insured before the act was passed. After the ACA was passed, American healthcare did have marginal improvements, but with it came new problems. Americans were divided over whether they liked Obamacare or not. Some did, some did not. Firstly, many Americans believed premiums and deductibles were too high, and they continued to increase. Generally, there should be an inverse relationship between deductibles and premiums to help keep costs low. If a premium is very, very high for a plan, then the deductible should be low. However, there was a positive relationship between premiums and deductibles. They were both increasing at the same time. The Obama administration announced that premiums will increase again by an average of 25% in 2017, and this is very scary for Americans who already feel like they don't have access to their health insurance. Average deductibles cost around $3,000 already. Paying this much before health insurance kicks in each year is not an option for families, rendering these exchange plans all but useless for those most in need. This is obviously some issues with the healthcare plan. Secondly, mandates are unsustainable and the ACA is too prescriptive. All Americans are now required to purchase health insurance or otherwise face a penalty of up to $695 a year. Either way, 28 million Americans remain uninsured. They would rather pay that $695 than the premiums that they may not be able to afford. In addition, all health insurance policies are required to cover all treatments, whether or not a consumer needs or wants them. This means that you can't just buy a small basic package if you're a healthy person, and this causes plans to increase. Many insurance companies have pulled out of the marketplace due to financial losses. This is decreasing the competition of the marketplace, and 17% of Americans may have no choice of a carrier, resulting in more of a monopoly than a market. Now, politicians are suggesting some solutions to problems with the ACA that Americans are facing. Affordability is obviously a big issue, and there are a few ways costs may be offset for individuals and families. A narrow network plan would allow insurers to avoid hospital and doctors that charge too high of prices. Insurers offer hospitals more patients in exchange for lower prices for treatments. This is an incentive for the hospital to lower their cost. It can penalize hospitals that won't negotiate. And it's been shown to lower premiums by 5 to 20% by using this method. Hillary Clinton suggested a little bit more of a straightforward plan to require all insurance plans to cover 3 doctor's visits a year that don't count towards a deductible. So maybe someone would be able to come in before the situation got more emergent and therefore would cost more money. Additionally, the U.S. could fall in line with other OECD countries and introduce a universal single-payer system. This is a much bigger reform, and it would take a very long time. But the physicians' proposal put forth by the organization Physicians for a National Health Program does outline a system called Expanded and Improved Medicare for All that would look like the single-payer systems in other OECD countries. Financing would be federal and paid for through progressive taxation, or this redistribution of wealth. Raised taxes should be offset by reduction in premiums and the absence of deductibles. Donald Trump has claimed numerous times that now, as president, he will be repealing the ACA. But we need something to replace it with. Many Americans agree with the repeal and voted for Trump. But it is unclear what will replace the ACA. Liberal Democrats generally favor methods that utilize the redistribution of wealth, greatest of which would be the implementation of the nationwide single-payer system that I mentioned previously. It is unlikely that Republicans will agree with an increased taxation, and such a change would require another major political battle that is unlikely to take place under Republican control of Congress and the presidency. So while this is a viable option, it's not very likely to take place in soon. It is most likely that elements of each proposed solution, as well as elements of the ACA that remain successful, will continue a new approach to the healthcare system in the United States. Liberals and conservatives may debate the how for a while, but the common goal is clear: lower the cost of healthcare and raise the health outcomes for Americans. Thank you.